If you ever see me wearing pink, we wear pink on Wednesdays. So if I'm wearing pink scrubs, know this was recorded on a Wednesday. But I love these socks because they have bacon on it. Don't go bacon my heart. All right. So
Don't
we're gonna.
bacon my back.
I'm gonna. I'm gonna unleash the Kraken. Stay adjusted. Adjust your lifestyle. All of it.
Working on it.
All right, let's get cracking. All right, so before we decompress the spine, I'm gonna address the tight muscles, okay? So feel free to squint, this, that, it's not gonna be pleasant. If you're here spending time away from family, work, LA moves fast like this, I like to go a little more aggressive when I can. She actually prefers it, and once you have a relationship established with patients, you could know what that threshold is for everyone, and you could kind of test the limits, but it allows you to have faster relief, less time here, spending less money and treating and whatnot. And then fortunate to have patients where I don't see them for months or years at a time, okay? Even though I would prefer they make it a regular part of their routine. Once you don't have pain, I know, should I ease up? It's gotta be nice. I am nice. Very nice. Okay. We could whisper because I got the mic right here. All right. So let me know if any of these spots cause shooting pain other than the area I'm pushing.
No shooting.
Okay. Okay. Do you prefer we use the rapid release or massage gun? Okay. 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 So you guys saw the spasm. So we're taking the neck. We want to start stretching, opening that up. Yeah, I mean, they could see. You see that? That's your levator. Okay, so when you start turning away, you're going more trap. When you start looking towards, you're activating levator. So I will have patients start turning and moving their necks as I start breaking up the muscle. So from here, I want you to look this way and away, okay? And slowly, so we could get all the fibers involved. Okay, look to the left, to the right. Now slide. Slide. No, you're not having it today?
No.
I thought that was pretty fun. Yeah.
It was fun.
Breathe, breathe, breathe. There it is. Okay, you feel it break a little bit. All right. Yeah, you wanted it. Down. Okay, and now we're gonna get insertion of the levator. All right, if there is a trigger point in this area, yep, it will go all the way to the eyeball orbital region. Okay, now look to the left. Any pain?
Like I feel it here for some reason.
Where? Low back?
Like here.
That's fine. So that is a trigger point. Okay, now look to the right. Did it go away?
I'm just feeling numbness in my hands.
Okay. It's fine. You want me to ease up? Nope. Okay. Okay, we're gonna get your supra real quick. Right in there. Breathe. One more. Yup. Yep. You felt that one break. Good. Is it still shooting down?
No, my hands are not.
Good. Almost done. One more. Breathe, 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 breathe. Right here. All the way out, 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 out. We got a rib. I'm just gonna go ahead and hit this real quick. And then we'll get the uppers at the end. Because if I do the Y strap and this is out the way it is, it's not gonna be good. You ready to unleash the Kraken? Mm-hmm. Drop the shoulder, let it go, let it go. There it is. Woo! Okay. Good? Yeah, it's been a while. It's not too bad, but let's give this side some love. Again, let me know if you experience any pain other than where I'm pushing. By depressing the shoulder, we're even more localizing or isolating this area. Breathe, breathe, breathe. And I don't do this to every patient. We've established years of rapport. You're definitely special.
You really want me here every 3 months or what? Or more often?
Breathe, breathe. Out. I know. This is definitely going to prevent you from getting very, very sore. There it is. Breathe. Okay. All the way out. So what I'm doing here, I'm shortening the muscle, contacting the region I want to go over. And now I lengthen or stretch it. Breaking it up. There it is. I want to do one more. You're okay with that?
Okay.
You ready? Okay. Relax. Let the shoulder go. Asa. Slower or less pressure?
Slower.
Okay.
Pressure.
Pressure's okay. Ready? Mm-hmm. All right. There it is. Where?
That opened up.
Yeah,
The
good.
second one was smooth.
Good. So you prefer going slower over it. All right. Breathe. This is a trigger point. Where is it shooting?
My hand.
Yeah. Yeah. So pushing somewhere here, which is close to the shoulder blade. It's actually the supraspinatus, right before it goes in under the AC acromioclavicular joint. So that muscle starts attaching here. So a trigger point there can refer down the hands. Okay. Pecs can also do the same thing. Okay. Scalenes. All right. Let's go face up. Loose John. Well, actually, let's go face down. We have to decompress you. Do my followers want skin caps? You think they do?
They always want. They don't get enough.
It's a fun one. Stop asking. I'm not saying we're adjusting the vertebrae. I'm not saying it heals anything. Does it add some relief? Yes. What it does is it increases blood flow to the region. It increases mobility as well as releases pressure in the region. It's a skin cap. What I am doing is I am releasing pressure between the muscle, bone, and the fascia. Fascia, let's say if you've ever ripped up a steak and you see that little white little sheets being torn, that is what the fascia is, okay? So increasing blood flow, increasing mobility, releasing some pressure in the region, which even if it's a little bit of benefit, I'm going to give my patients the best chance to experience complete relief with least number of visits possible. So without further ado, I give you skin calves. You ready? All right, I'm going to lower it down to here, if that's okay.
Yeah.
All right, put your arms right over there. Okay.
Go hard.
Is it?
Yeah. I haven't been good.
You're bad, huh?
Not bad.
Okay.
I haven't had an incident where it hurts
This bad?
non-stop for a long time. This was
Okay.
not good.
Wow.
You know how
Yeah.
I crack myself?
Usually
It
it
doesn't
goes.
even crack anymore. Why doesn't it crack?
Muscles are too tight, so it's not allowing the joint to move. So what we're gonna do is decompress your spine, rehydrate it in a sense, because that disc is the shock absorber. So the red part is the disc, any jumping, bending, so this absorbs all the shock, allows us to move. If this thing is compressed, it's not letting the joints do its job. So when this isn't moving, the joint doesn't move, okay? So when you try to adjust, there is no ability to move and cause a pop or cavitation. So by stretching her, we take this and bring it back to here, allowing optimal movement. So seems simple, a little more complicated, but we get results at this clinic. Okay. All right. All right. So it's been a while, so we're gonna start right here. Okay. It's probably gonna be a little tender, uncomfortable. Breathe in all the way out. There we go. Yep. Right now I'm at L5. It's not too bad, but I could feel above my fingers not moving. This one's more tender than the one before. Yes or no?
Yeah.
Yeah. Okay. This one above it doesn't feel like it's moving. Yep. All right. So we're gonna take our time on this one. This is L3. L3, if it starts compressing the nerve on that level, you will get numbness, tingling, burning. I don't want to let go, but it's gonna be like this region right here for L3. Okay. There we go. Something just opened up. All right. How's this L2? Better or worse than the one before it?
A little bit less than
Less.
normal.
Okay. Relax. Breathe. That one? L1, genital regions. So I've actually had patients, once I get an MRI and I read the results, if there's a compression of that nerve at L1, I've asked if, the one I remember was a gentleman, I said, any symptoms or pain you're experiencing in your genitals or your testicle region? He's like, how did you know? I've been going to doctors for months and no one could figure out what's going on with me. And we figured out it's a disc herniation compressing the L1 nerve. And we got him better, which is a weird one, but pretty cool. Body's amazing. Again, everything is a map. Relax. Okay. You just loosen that muscle up. Relax it. Oh.
That's why it's so.
Okay, yeah. This stuff is not moving. Okay. So with her, we've decompressed her with this Cox table. We've tried the Airflex, Leander, even on our heel decompression, and everyone's different. Her body responds best to this one. So we make sure to schedule her appointment for this table specifically. So every patient we schedule based on treatments and tables they need. Ready? Breathe in, out, and I'm doing a better job of switching sides so I'm not repetitively moving the same muscles on each side all the time. So I'm just trying to make a few adaptations to my approach to allow longevity. How's this? Tender? Yeah, it's not moving. Your thoracic spine, which is your mid back, is not moving well. The 4th level helps innervate the heart. The 10th level helps innervate the breathing diaphragm. A lot of people with text neck, hunchbacks, they could experience these issues. That's why some patients, when I do the Y strap adjustment, they kind of need to catch their breath or start crying. I've had that a bunch of times, which is actually a very good response.
Crying?
Yeah, all your emotions are stored here. So if it's compressed, the nerves aren't firing. So now that we open it up, all that stress, emotion that's been kept inside is trying to escape. And I tell patients, look, if you need a minute or two, I let them know that it's okay. And if they do allow themselves to let go and release it, they feel immediate relief.
Like when you press there, I can feel it in my throat. So weird.
Is it moving your neck? That's why?
I don't know, maybe it's the
Yeah,
pressure.
well, it can. I'm pushing here, but then you're also flexing or extending your neck when I'm doing this, or it's happening automatically. Okay. But yeah, I am kind of compressing or restricting your ribs from moving, so it can be. Okay, you okay?
Yeah.
All right, we usually do 2 sets, but with her, we've established a 3rd set actually benefits her, so we're gonna do 3. And then come, just see this. This is what her skin looks like, the color, but see where I'm at? It's red, so you're getting blood flow to the region, which is a very good thing. Blood in the region means repair. So the fact that there is blood going there, it is gonna help promote the healing process, all right? You ready? This one, we're gonna go even more of a stretch, but I'm gonna start pumping slower and less pumps, okay? Okay, yeah, L5 feels good. L4 is not good. You all right?
Yeah.
Tender, right? Well, okay. There. And then once we're fully done, we're gonna have Alexa set up in the rooms to have nice relaxing music so everyone can feel like it's their own getaway time, like me time, I don't like to have clocks in the rooms because when I was a patient going face down, I would just hear that second thing go, and it's annoying. So a lot of good changes and the upgrades happening at the clinic, and it's all for your experience. Okay. Yeah. Are you ever sore after these treatments?
After long pause, yes.
After what? A pause? Yeah.
Pause, yes. But if I come more often.
All right, I'm sure I'm going to see you a few more visits. Okay. All right, relax, breathe. Out. Let it go. Breathe. Out. And then I just hold the mastoid occipital region and just give the spine a nice, entire, generic axial stretch, decompression. They appreciate it. Sometimes it just pops right there. Let's go. Okay. All right, let's go on your side. Face me. It's pretty windy today, huh?
Yeah.
Relax. Okay. Okay. Can I? I'll do both at the...
Making your life harder.
Girl, it's lunchtime already. Ooh, there we go. What were you saying? All right, but this is pretty funny because she has them on both fingers. Took me a second to figure out how to do it, but yeah, it's not gonna pop. All right, you ready? Ready for unleashing the Kraken? Breathe in. Oh, this is gonna pop good. Out. There we go. It's been a while. Yeah. Rusty. All right. Look up. Look straight. Good. Breathe in. I've gotta really lock you up. Out. Get these ribs. Drop. Breathe in. All the way out. Just let it go. And here is the main problem. It's your left trap. So I'm actually gonna target, move the shoulder blade out, get all these ribs back in place, okay? Breathe in. I just need you to look straight, okay? Breathe in, all the way out. Drop, there it is. Good. Okay, good job. All right. It's not gonna be pleasant. Let's get the ankles. You want toast too?
I would love that. Man, those say my socks don't match.
They do.
Oh my God.
They do. Puma. Yours don't?
He's judging when it
Show
comes
them. Got me craving hot dogs and like burgers with that, but I like it. Especially this one. It looks like an Armenian carpet we all have at home. No? I come. Thank you. Yeah, I love Galil style. There we go. Yep. You all right? How's the ankle feel? It's moving fine. It wasn't your ankle. It was the navicular. Yep. There it is. You all right? It's gonna hurt.
Yeah, my pinky sometimes starts hurting, you know?
Is it numb?
Doesn't go numb, but it starts hurting when I'm holding the phone.
Does that make it numb?
Right here.
Does that make it numb?
No.
Oh man. All right, hold on. Let me just really get this. I need you to relax it. There it is. There it is. Ooh. Okay. Breathe in. Yep. Out. And I got one more. Get your inside. You ready? Okay. So before the white strap, I noticed her natural position was somewhat like this. I may be dramatizing a little, but just want to show you guys. So if she's like this, because of tight muscles and no movement of the joints, and it's not going to be good. All right. So we're going to actually adjust her first, make sure everything's aligned so we get an even better result with the white strap. Okay. We already did the lowers here. Let me get C23. Gonna be very quick. Drop the shoulder. Drop. Let it go. Okay. Could be tight muscle. It's all right. Breathe. I know. Breathe. I tell patients, give me 2-3 days before you give me a Yelp review. Let that soreness get out of the way. It's all lowers for you, even on this side. Relax it. Ready? Welcome back to adjusting your lifestyle. Drop your shoulder. Drop it. Drop. Yeah. It just sucks these microphones don't get.
What's in my head?
Dude, that was a lot. But it's expected. I knew this was gonna happen. We just unleashed a whole lot of cracking. So anything spasming needs some, we're good. It just sometimes takes a second, a few minutes, just allow the body to get the cerebrospinal fluid flowing. Ligaments, muscles getting used to what the hell just happened. Yeah, we're not done. Face up. So imagine if I just thrusted HVLA with that much going on.
One was more than the other.
Yeah, but the muscles on that side are tighter. So
Yeah.
you may have more movement here, but you could be compensating. So sorry, did I just hit you? Whatever you're doing, if your phone is on the left side, start switching tasks.
It's
Okay.
usually straight, but I sleep on this side.
Okay.
Um,
Yeah, and that's why this is getting elevated. All right, lift up. Good.
Scared.
Are you choking?
No.
Okay. Breathe in. Just relax. Breathe in. Oh, yeah. Out. Breathe in. Lucy. Loose. Breathe in. Unleash the cracker. Put your foot down, yeah? Oh,
I like you. That was one pop.
yeah, one big one.
Yeah.
Next one will be more.
Ooh.
Your muscles were tight. Did you see how much you came up? Usually she just.
But it's my head. My head is numb. Okay.
You ready?
Yeah. Oh,
It's this one.
it's hot.
Yeah, that's good. Muscles, nerves, everything's firing. So, all right. All right. Give a.
Felt like being rusty. Now not rusty anymore. I don't know how else to describe. But yeah, it's good. Definitely. You guys should come. It helps a lot. Just a lot of release and release of tension. Just feels good. Feels great. So just trust, come, take care of yourself. He's really good at what he does.